Hello, thank you for tuning in to the My Marketing Team, Staying Connected to Patients in Crisis, featuring My Marketing Team and Dr. Melrose of Brookside Optometric Group. Today's webinar is brought to you by Premier Academy 360, designed to attract and retain patients and increase revenue. Premier Academy 360 offers effective and actionable education that's credible, simple, and results-driven, and is provided at no charge to you. They have workshops, webinars, resource libraries, e-learning. Visit learnacademy360.com to learn more. Quick disclaimer, not professional, financial, medical, or legal advice. Consult with professional association guidelines, state labor resources, financial advisors, and or an attorney for advice. So what is My Marketing Team? For anyone new with us today, I'd like to quickly share what we are. We are a benefit of VSP Global Premier Program Practices and provide you a dedicated team of marketing professionals. We are here to help you reach, connect, and engage with current and potential patients. We craft monthly newsletters with marketing materials, promotions, and tips to keep you up to date with social media trends. We share content, tips, and tools to help you and your practice save time. We create fresh and engaging marketing materials to share to your patients. We offer monthly educational marketing webinars, much like today. And during this time, we have pivoted our regular efforts to provide support for the COVID-19 crisis. It is my pleasure to introduce Dr. Melrose. Dr. Robert Melrose has been in practice with his wife, Rosemary, in Stockton since 1982. In addition to his practice in Stockton, he taught at the University of California, Berkeley School of Optometry for 10 years as an assistant clinical professor. For 17 years after that, Dr. Melrose was a partner with Griffin & Reed Eye Care, where he specialized in screening and post-operative care of 25,000 LASIK refractive surgery cases. He rejoined the teaching faculty at UC Berkeley in 2011, where he co-operated the refractive surgery clinic. Dr. Melrose retired from teaching in 2015, and he is currently one of 11 ODs at Brookside Optometric. He is here to discuss his experience on creatively marketing his services during COVID-19. Take it away, Dr. Melrose.
Thank you very much. Again, I'm Dr. Melrose from the Brookside Optometric Group. I'm speaking today to discuss some of the items we put into place during our COVID-19 shutdown and how we have responded to trying to reignite our practice now that the practices are opening up. We're going to talk about uncharted territory today, responding to the crisis, creative thinking and action, and a roadmap to reopening. Most optometrists were anxiously awaiting the year 2020 to market the year of vision to our patients. But before we had a chance to breathe, COVID-19 came in and flipped the emphasis of this year to one of personal and professional survival. Nothing has impacted our profession like this before, leaving us in unfamiliar territory as to how to manage how we serve our patients and reignite our practices when this is over. Our practice doors closed on March 16th. At that time, we had hundreds of pairs of glasses and contacts waiting to be dispensed, with hundreds more in the pipeline. We immediately called and rescheduled our patients out into April. We naively thought that we'd be back in business by then. We had to call them back later to put them out indefinitely. We also recorded a message on our office voicemail about how to reach us for emergency care, and we simply went home that day. Now we had to make sure that our patients knew that we had not abandoned them. That week, we started a social media campaign to let our patients know how they could get their contact lenses, their prescriptions, and replace broken eyewear. We created a frequently asked question list that we posted on our website and amplified that message through our voicemail messages and social media. The goal was to maintain contact with our patients and reassure them that we were still here for them. The doctors then met and established an on-call schedule to handle all emergency eye care visits. We established a rotating schedule to allow coverage 7 days a week, and we left contact numbers on our answering machine for each doctor on call for that day. Then we sat down and simply asked ourselves, what would we be worried about if we had learned that our doctor's office was shut down? One important step was to make sure that all of the sites that make up our internet presence were in sync. We updated every online channel we had to make sure they all portrayed the same message. This is an example of the notification we put on our homepage of our website, discussing not only that we were closed, how to contact us, and expressing appreciation to them that this would put their lives at a hardship as well as ours. This is an example of several of our social media posts we did. The one on the left discusses the closure itself. The one in the middle discussing how patients can get contact lenses, and if they're running out, how they can contact us to get more. And the one on the right is discussing some questions they may have about glasses and contact lenses that they may need. Again, the goal was to make sure that our patients knew we could still help them if necessary. When it became evident that this closure was going to last longer than anticipated, we decided to hold curbside dispensing events for those patients waiting for their glasses. We set up tables in our parking lot to hold the glasses and contacts that were ready to be dispensed, and posted signs instructing patients to drive up to the tables but stay in their cars. Staff members wearing masks and gloves took the patients' names, found their glasses, poured the glasses from the bags they were stored in onto a sterile tray, and presented that tray to the patients. Patients then picked up their glasses from the tray and drove away, and the trays were re-sterilized. Patients were advised in advance that adjustments would occur after reopening, and that any outstanding balances on their glasses would have to be made by phone before they could receive their glasses. We held 2 of these events, each one lasting 2 hours long, and in that 4-hour time frame, we were able to dispense over 250 pairs of glasses and nearly 100 sets of contact lenses. The doctors assisted the staff at these events to show patients that we were there for them. It gave us a chance to interact with their patients and show our appreciation of their patience with us during this time. Here are 2 examples of our social media posts regarding our curbside dispensing events. We knew that imagery and videos are powerful tools normally, but even more so during times of distress. Staying connected on the internet is crucial, especially during these trying times. Our next COVID-19 social media campaign addressed the changes we implemented to make our patients feel more comfortable returning to our office. Our goal was to show our patients that we were busy during the downtime, making changes to ensure their safety when they return to our practice. We began marketing these structural and policy changes a month before we reopened to plant the seed that we are indeed a safe place for patients to come to. Structurally, we have done what many practices have done, adding plexiglass shields at our reception desk and financial checkout stations, adding new breath guards in all of our slit lamps, and new frame sterilization techniques, etc. Policy-wise, we have made changes to ensure the safety of our staff, patients, and their families, such as running at a reduced schedule for now, providing masks if patients do not have one, limiting patient companions during eye exams, performing temperature screenings at the front door, adding touchless payment systems, and offering free direct shipments of contact lenses, and much, much more. Patients need to see that this is not business as usual, and that their safety comes first. We have posted several videos going over the safety changes within our practice on our social media platforms and our website. These can be made with an iPhone, and believe me, they do not have to be Oscar quality. The goal is to give your patients the reassurance they need to feel safe, so they will pick up that phone and call for an appointment. Don't wait for your patients to see all that you have done after they arrive. Tell them in advance so they will arrive. Just remember, too, that our patients are scrutinizing us online and in person as to how we have responded to keep them safe. During our shutdown, we have had many patients respond to our social media posts expressing gratitude that we made these changes. Since reopening, we have had many patients comment each day that they appreciate the changes that we have put in place for their safety. Remember, too, that these posts cannot simply stop because you've reopened. We continue to post on social media the various ways we are being COVID aware in our office, as well as how happy we are to be able to see our patients again. We have included messages thanking our patients for being patient with us, thanking them for putting up with us during these trying times, and that we are hoping to get back to full steam as soon as the CDC allows us to. The key themes we stress are that we have done a great deal to keep our patients safe, and that we truly appreciate the fact that our patients allow us to be their doctors year in and year out. Thank you for listening to what we have done for our office. I hope it can be of some help for everyone out there. Thank you.
So thank you so much, Dr. Melrose. We really appreciate your time today. And we hope that our listeners have learned more about marketing during COVID-19. You can easily share this information with your patients in office or through your social media, like Dr. Melrose was mentioning. Just some quick housekeeping before we say goodbye. Visit our website to find the My Marketing Team COVID-19 Resource Kit. Stay in the know by following our VSP provider's Facebook page and Twitter accounts. And lastly, if you're looking for a great social media resource, visit our website to request a Hootsuite account. Should you have any questions for Dr. Melrose, please reach out to us at mymarketingteam@vspglobal.com. We will be happy to forward those to him. Thank you so much for your time today. We'd love to hear your thoughts on today's webinar. It helps us provide topics and content that you're interested in. Have a great one.